The International Conference on AIDS and Sexually Transmitted Infections in Africa, ICASA 16, was held in Addis Ababa from December 4th through the 8th, 2011, with a theme of Own, Scale Up, and Sustain.
I would like you all welcome to Ethiopia for the 16th International Conference on AIDS and Sexually Transmitted Infections in Africa.
Although the main objective of the conference is to eradicate HIV, previous editions of ICASA have not been too strong when it comes to disability inclusion, both in terms of visibility and accessibility.
We have had a bitter struggle to make people aware about the importance of mainstreaming disability into the conference, and also to make them aware that issue of disability is not something negligible, something that you can't forget.
For one most reason, it's that disability and disabled people are completely forgotten on any kind of strategies. I mean strategies for prevention, for information, access to services, access to economic and social inclusion.
For the 16th ICASA conference, many persons with disabilities from different countries attended the conference. Moreover, international donors, partners, and persons with disabilities activists came from different countries. The Disability Networking Zone was one of the zones hosted by the community village. Handicap International and IDDC members such as HERD, Sightsavers, and DPOD organized a full week-long disability networking zone whereby persons with disabilities and non-disabled persons from different countries of sub-Saharan Africa made presentations and debated on HIV and disability. The motivation of the Disability Networking Zone was fantastic. It was one of the busiest zones in the community village. The theme of the zone was Sustainable Disability Inclusive HIV Response for Universal Access. To address this theme, there were presentations, roundtable discussions, skills-building workshops, and moderated sessions that addressed various perspectives on disability and HIV by presenters from South Africa, Ethiopia, Uganda, Sudan, Kenya, Burundi, Zimbabwe, Senegal, Mali, and Cameroon. At the Community Village Performance stage, there was a slogan entitled "We Too Can Dance," and during the dance ceremony, we saw the amazing talents of persons with disabilities. The deaf can follow the beat of the music. Physically disabled people can perform following the rhythm of Amharic songs. When provided with the opportunity to express their artistic talents, persons with disabilities can perform as beautifully as anyone else.
I want to thank Handicap International, who have supported a number of PWDs, especially a person with disabilities in Ethiopia. What we have seen, in fact, it was a good example that disability is not inability. So, especially the show, it was really educative. We learned a lot, and I think we'll take the information back to our homes.
HIV and AIDS knows no boundaries. It knocks at the door of everyone, whether he or she is disabled or non-disabled. As we observe, this is the case of many disabled people in Africa. HIV and AIDS doesn't discriminate, even when policymakers and the community do.
Discrimination can be addressed through legal frameworks. So we need to work and make sure that there are legal frameworks which prevent discrimination. And of course, legal frameworks need to be implemented.
The involvement of disabled people's organizations as well as disability-led organizations such as Handicap International and HERD will be extremely important for the coming ICASA in Durban. In the meantime, more research and studies need to be undertaken to increase the knowledge base so that these findings can be presented and disseminated during the next ICASA. With more evidence, one can argue more effectively for the inclusion of persons with disabilities in HIV policies and programming.
You only know if when you know how many deaf people you've got. So you do need that kind of data. You also need to know what kind of disabilities are people living with HIV actually getting? We do know a little bit about mental health, we do know a little bit about neurocognitive disorders, but we know very little bit about other things, like other impairments, like blindness that is related to HIV, but we do need that kind of data.
Cohesion and integrated voice matters. Solidarity or fraternity among persons with disabilities also makes a difference. Those who have different impairments can take the leadership by standing together. Moreover, the policymakers should know that there are not special needs, but rather recognize them as different needs. It is a question of addressing disabled people's rights. Persons with disabilities had been taken as if they were insignificant in HIV programs and policies, but now it is the right time to incorporate persons with disabilities in every response of HIV/AIDS. Zero infection, stigma, and death will be only in the papers unless persons with disabilities are at the center of it.
We cannot have universal access. We cannot have zero infection. We cannot have zero death. We cannot have zero discrimination if we forget 15% of the world, if we forget 1 billion of the world.
We hope in the coming ICASA, persons with disabilities will be more visible and hearable. See you in Durban.
Buddha.